Hi, it's Ray Gustafson. We're joined on the phone by Dr. Mark Nikkel, orthopedic surgeon with Bronson Orthopedic and Joint Specialists in South Haven. How you doing today, good doctor?
Very well. How are you?
Yeah, I'm doing well. So give me a little background about yourself, if you would, please.
I'm a board-certified orthopedic surgeon. I did my residency in Chicago, followed by a fellowship in sports medicine out in California. I practiced in Chicago for approximately 15 years, and I've been in practice now in South Haven now for the past 4.
Past 4 years, and you're right there on South Bailey Avenue, right, in South Haven?
Yes, I am.
Yeah. Now, you're trained in treating athletes with sports injuries. What else are you trained in besides that?
Besides sports injuries, I incorporate joint replacement, whether shoulder, hip, or knee. So basic trauma, things of that sort.
And we'll get to this I've got a bunch of questions for you here because I want to find out a little more about what you do, but you are accepting new patients at this time, correct?
Absolutely.
Yeah. All right. So what we want to talk about today is joint pain in high school athletes. Now, some might think, doctor, that, they're kids. They don't have any issues as well. So tell me about joint pain in high school athletes and how to treat some of those injuries. First off, what are some of the more common sport-related injuries that are seen and that you see in some of the high school athletes?
Typically, joint pain in adolescence is caused by one of two methods. It's either repetitive activity, the traveling player, the baseball player who doesn't take any time off from his activity, versus the player who has an unfortunate incident or accident injury during the game of play, whether that may be football, basketball, baseball.
Is there any one particular sport that stands out, or is it pretty much all of them that you see the most issues?
No, typically, but what I see most of is during football season. Typically, knee and shoulder injuries. Occasionally, we'll see runners that have foot and ankle problems, knee problems, and then, of course, with baseball, typically shoulder and elbow.
Okay, so cross training is pretty important, I would guess.
I think one of the things I preach to my adolescent athletes and to their parents is that they need to play more than one sport. You look at the ones that get injured, they're typically the ones that are playing baseball 9, 10, 11 months out of the year, and they're not allowing their arm to rest. Their arm needs to rest for a minimum of 3 months, and I think that's so critical to avoid injury and repetitive injuries that we see amongst the adolescent athletes.
So I'm a parent. When should I become concerned about my child when they do start complaining about having some pain?
I think pain in general should not occur. I mean, there's different pain, obviously. I think one of the things that a child or an adolescent needs to learn is, there's pain from exercise and that pain that occurs after your workout versus a pain that's associated with injury. Typically, an acute injury is going to be a sharp type of injury, and I think the most important thing that a child needs to realize is that if you play through an injury, you're going to turn typically a simple solution into a complex one that may involve surgery. Typically, injuries amongst adolescents are something that can be addressed easily by ceasing the sport initially, medications, icing, and physical therapy. And then typically what we see amongst these patients is that loss of flexibility and muscle compensation or weakness has resulted in those injuries. And so by restoring that flexibility and getting them into a good rehab program that they can incorporate during the season will prevent them from reoccurring with that injury or making it worse.
So if you do treat a high school athlete for a sport-related injury, what are some of the more common treatments that you use?
Initially, for an adolescent, we avoid injections. That's one of the last things I would recommend. Typically, ceasing the sport right away is the most important thing to make them recognize that, look, they have an injury and playing through this injury is not right. Letting the parents know that they should not be playing their sport. Getting them into physical therapy, working on flexibility, working on muscle balancing are are very critical. Icing, anti-inflammatory medication, typically over the counter for adolescents, is also recommended.
So if somebody's looking to set up an appointment with you, how can they go about doing that, doctor?
They can call our office, Bronson Orthopedic and Joint Specialists, at 269-639-2866.
Say that number one more time.
269-639-2866.
Dr. Mark Nikkel, orthopedic surgeon with Bronson Orthopedic and Joint Specialists in South Haven. Thanks for sharing the good news with us, doctor.
You're very welcome. You have a great day.